Hello, Namaskar. I am Dr. Anupam Jena. I am an interventional cardiologist at KIMS Bhubaneswar, and I prefer to do structural interventions, cardiac electrophysiology, complex coronary angioplasties, peripheral vascular interventions. So today I am going to discuss about a case of Mitraclip. Mitraclip is a therapy that is done for the management of severe leakage in a valve. We call it mitral valve. And the leakage in the mitral valve is known as mitral regurgitation. So what do we do in Mitraclip? I'll like to tell you. So I would like to present this by showing an example of a patient. In this case, we have a patient, a 71-year-old female. He presented with heart failure, which is not responding to the standard medical therapy. So we call it refractory heart failure. And because of heart failure, refractory heart failure, which is usually presented as breathing difficulty or swelling of the legs, swelling of the abdomen, and because of these heart failures, the patient has got multiple hospitalizations. And moreover, she was unable to breathe. So she required ventilation through a mask. We call it non-invasive ventilation. This video is for patient information, so I try to keep the language as non-technical as possible. Here is an echocardiography. In this echocardiography, so this jet that we see here, that is the mitral regurgitation, or that is the leakage in the mitral valve. So this is the valve and this is the leakage in the mitral valve. Apart from that, this patient also has a reduced contractility or reduced pumping of the left ventricle. And because of the combination of reduced pumping of the left ventricle and severe leakage in the valve, this patient has got a refractory heart failure, which required multiple hospitalizations. These type of cases are very high risk for mitral valve surgery. Open surgical valve replacement is usually considered to be very high risk and is not considered to be worth it because the mortality after surgery is very high. So Mitraclip is a therapy where what we do, it is like a stapler. So we put a stapler between these two, between where the jet is leaking. So we put a stapler here and that takes care of the leakage, and then that will take care of the heart failure. So to do that, we need a good echocardiography. So this is an example of an echocardiography of the heart, and we see that the left ventricle, the main chamber of the heart, which pumps blood to the different parts of the body, is weak. And in addition to that, there is severe leakage in this valve. This is called the mitral valve. So this is the Mitraclip system. It's a complicated system. It is usually put through the right groin. Usually, the patient, if this procedure is done under general anesthesia, and we have to obtain various artery and vein punctures, then we put this device, we give anticoagulation so that the device does not clot. Sometimes Polish catheter is put, and then we do these procedures under the guidance of transesophageal echo. So transesophageal echo is like an endoscopy. It is a special type of echo. It is done like an endoscopy, and an endoscopic probe is put into the stomach, and the heart is imaged through that. So that gives us a very clear imaging because the heart lies just anterior to or ahead of the food pipe. So here we are seeing this. So these are transesophageal echo images. So everything is done under direct vision, very safe and controlled thing. So we need to puncture this septum to go to the other side of the heart. And then once we go to the other side of heart, we make some measurements. like this. So here we are trying to puncture the septum. This is called the septal puncture. Then, so in this case, once we did the septal puncture, so this is the transesophageal echo probe. Then we took this device across into the left atrium, because the mitral valve lies between the left atrium and the left ventricle. Then here is the clip system that is inside the heart. Then with proper guidance from our imaging, that is the transesophageal echo, we advance the clip into the heart. As we can see that here we have opened the clip. Now it looks like a flea. And then with proper imaging, we see that the clip is positioned. For example, here the clip is positioned properly. And in another view, the clip is positioned properly. Once that is done, we do the 3D echo. The 3D echocardiography is done to see the position of the clips. And then finally, we catch the clips. So here you can see that these clips have been caught. So they are not freely moving now, and they have been caught. And after catching the clips, as you see here, that the regurgitation or the leakage in the valve has significantly come down. So that's what this therapy does. It replaces open heart surgery and the life risk or the suffering associated with an open heart surgery in these high risk patients into a simple procedure where a clip is put to close the valves so that the leakage is reduced. And here we see that the clip has been closed and then the clip is released like this. And in this case, a second clip was also given because there was some leak here. So a second clip was also given. And after giving the second clip, the leak has, so these are two clips that have been deployed. And after giving the second clip, the leakage has significantly come down. So from very severe leakage, it is mild leakage now that is persistent. So this type of leakage is compatible with a good outcome. We can do any procedure, but then we have to consider what is the outcome on the patient. So in this group of patients are very high risk patients who have heart failure, who have severe leakage, who have reduced pumping capacity of the heart. And in these cases, the Mitraclip therapy, by giving a very minimally invasive treatment option, reduces the mortality or reduces the risk of death and the chances of hospitalization for these patients. Basically, Mitraclip is a minimally invasive treatment where the leaflets are caught and the leaflets are then stitched in a way. The leaflets are stitched together so that there is no leakage, there is no space for leakage. If there is a space, then the blood can come out. But by putting a clip, we are bringing these two leaflets together, stitching them together, and that's how we reduce the leakage. So this is for the information, this is for educational information for all of the patients who are suffering from heart failure and severe mitral regurgitation, that there is hope, there is a treatment option available, which is called Mitraclip therapy. So do consult your doctor for Mitraclip therapy in the appropriate patients. Thank you so much.